Okay, thanks again, everyone. My apologies for the technological difficulties. I'm excited today because we're going to be talking about menopause. And I'm going to give everyone just a couple of minutes to rejoin in case there were those who lost their connection just now. Hi, Teresa. Thanks again for joining. Sorry about the technological difficulties. Hi, Tasha. Thanks again for joining. Sorry about the tech challenges, but we'll go ahead and get started because I'm excited to talk with all of you today about menopause, what it is, how we can deal with it and address it, and some things I want you to keep in mind in case you're experiencing any symptoms or if you have any questions for your doctor, your nurse practitioner, or your physician's assistants. Hey, Tasha. Hey, Teresa. Thanks again for being here. So let's go ahead and get started. And again, thank you guys for hanging on there as I went through some tech difficulties. So just to introduce myself, I am Dr. Madeline, your board certified OBGYN, international speaker, and published author. I'm very happy to be with you today. What I do predominantly is I help busy women directly access both birth control and tailored GYN care so that they can live more free lives and really try to accommodate their busy schedules. And so if you're here listening or if you happen to catch this on replay, please by all means follow me on other platforms as well. And on Facebook, on Instagram, and on Twitter, I'm on all of those as Dr. Madeline MD. That's DrMadeline MD. So, thanks again for being here. Hello, Tasha. Hello, thank you. So, let's talk about what menopause is. So, menopause is basically when a woman goes through what we call, in layman's terms, the change of life. And so, the average age for menopause is about 51 years old. In the U.S. and across the globe, it's about 51.4 years. And so what exactly does that mean? So I'm going to just share a couple of facts with you guys. So, and I don't know if you knew this already or not, but when we're born, when baby girls are born, we're born with all of the eggs that we're going to have in our lifetime. That's generally about 1 million eggs. And then when we go through puberty, puberty happens usually between ages 10 to 13 or so. It's when young girls start to have pubic hair, other signs of hormonal development happen, their breasts start to come in, and usually they'll have their first menstrual cycle. And so when we hit that point, our eggs have actually decreased from the million that we had at birth down to 300,000 at the time of puberty. So that's a big drop, right? And then as we continue to go through our reproductive years meaning, any time from the time you have your first cycle until generally about, again, age 51, most women will release an egg every month. That's when we have our monthly cycle. And the release of that egg allows for the egg to meet up with a sperm, and that's when pregnancy can happen. So over the course of our reproductive years, most women will ovulate between 300 and 500 times. That's a lot of times to get pregnant, and that usually happens until about age 51. So what happens when a woman approaches menopause, and that those hormones that her body is used to seeing from those eggs being produced every month, those hormones start to decrease drastically. And so by the time a woman goes through menopause, she has no more eggs left. Her hormones have significantly shifted. And that's usually what's going on in the woman's body when you get to the point of feeling some of those symptoms that we're going to talk about today, those menopausal symptoms that a lot of women will describe as really making them uncomfortable. So how do you define menopause? So again, for most women, it happens around the average age is about age 51. But what a lot of women don't know is that you can start having those symptoms several years before you go through menopause, and sometimes a few years after you've actually stopped seeing your cycle. Hey, Denise, thanks for joining. Happy Sunday to you too. And so because you start having these symptoms, those are all within the realm of that time window when a woman's body is shifting. So the period that happens before menopause officially happens is called perimenopause. That means your body is starting to show you some signs that maybe it's about to start functioning differently because the hormones in your body have shifted. And so what officially defines menopause is when you have your cycle and then you have no more cycles for 1 year, for 12 months total. And so a lot of times I'll have patients come in and, we'll talk, or they'll call and they're feeling different symptoms, and maybe they've gone about 8 months without having a menstrual cycle. Even if they go 8 months without having a cycle, and in that eighth month they have a regular period, or even if it's irregular, as long as they have some bleeding, that actually restarts the countdown, the calendar for that woman. And I know sometimes that's very frustrating for women who may have started to get used to things being a little different because they believe they're fully in menopause. But officially, you have to be without a cycle for 12 months after that last period. Okay, so that's officially when a woman is in menopause. Now, when we're leading up to menopause, there can be a variety of things that happen to a woman's body. She may start to feel some of those hot flashes and things like vaginal dryness, even though she's still having some cycles. And many times for a lot of women, those cycles do become more irregular as you approach that very last cycle. Periods may become heavier. They may not come on the same schedule that a woman was used to when she was not close to menopause. And sometimes those things can cause, as you can imagine, some stress for women. So I want to talk about 3 things that I think are important for all of you to know when you're thinking about menopause, you're thinking about your next visit. Maybe you're going to see your provider, and it's one of the things that you want to talk about. And when I say provider, you might be seeing your physician, a nurse practitioner, or a physician assistant who is going to see you as part of your regular annual GYN exam. And there are 3 things that I want you to keep in mind when you see them, especially if any questions about menopause come up. So the very first thing I want you to remember, if you're preparing to go see your provider and talk about menopause, I want you to remember that it's important to try to write down any symptoms you may have as they come up. Now, what happens very commonly, and this is myself, and I hear it also from many of my patients, is that, as time goes on, we might start to remember things a little bit differently, or remember less easily than we used to. So what if we're starting to forget some things? What I recommend is women keep like a little notebook, or these days it's very easy to do on our phones. Just start a little notepad section. And what I tell women to do is, hey, if you're having a symptom, something that you want to remind yourself to talk with me about when you get into the office, just jot it down. I'm always happy to talk with patients regarding whatever symptoms or concerns or questions they may have. And sometimes it's easier for the patient if they write it down so that they can make sure that their concerns are heard. So those symptoms can be anything. They really range with menopause. With menopause, those symptoms can be psychological, they can be physical, they can be vasomotor, or in other words, related directly to the hormones that may be shifting in our system. So what are some of those things that go on when a woman might be going through some early menopause or perimenopause? She might have the sensation that her heart sometimes beats a little bit more quickly. She might have hot flashes. Hot flashes, the easiest way for me to describe them is that you feel almost like there's almost been like an oven, or someone has elevated your body temperature from the inside. And you might see people who start to carry fans or really wave to try to cool themselves off. It's probably the most commonly described symptom among women who feel any symptoms related to menopause. Now, not every woman will go through hot flashes, but usually as high as 87% of women who go through menopause will experience hot flashes. So that's something to keep in mind. Another commonly reported symptom is vaginal dryness. And this is one that's really important to to write it down if you think it's something you may not remember. But I definitely encourage women to talk with their OBGYNs or their providers about it, because sometimes women feel very shy or self-conscious about the fact that they might have some vaginal dryness. And why? That's usually because vaginal dryness affects our sexuality, our ability to maybe have sex certain ways, or, when we're in our reproductive years and we have all of our hormones in our bodies going through our bodies, it's easier for our vaginas to become moist. It's easier for someone who has penile vaginal sex to have that type of sex because our vaginas are moister due to the hormones. And that becomes less so when someone goes through menopause. And so I always encourage my ladies to write these things down, because, it's important to be able to feel comfortable and to have open and honest conversations with your providers. A lot of times there are different vaginal creams and gels that we can talk about, some things that might help women so that they don't feel that they're so alone with these symptoms. These symptoms are very, very common. Other symptoms that people might have, they might feel more irritable. They might feel sad some days and they don't really know why. I commonly have patients come in who describe, trying to get a good night's rest and twisting and turning a lot because it just feels so warm. And if they happen to share the bed with anyone, then sometimes there's concern because the woman who might be having hot flashes wants to always kind of tap down the temperature in the room so that it feels cooler. And sometimes the person sharing the bed finds it to be too cold. But again, these are normal things that women go through when they're going through menopause. Sometimes women have shifts in terms of even libido, whereas many women, when they're in their reproductive years, one of the things those hormones do is they naturally influence our libido. When we have decreased estrogen compared to what we have when we're in our reproductive years, then our sexual libido can decrease. And again, it's something that happens very commonly in women. Now, I've also had patients on the other side of the scale where they have an increased libido going through menopause. So it really ranges. And if you have increased libido, God bless you. That's a beautiful thing. I've had patients come in complaining that their male spouses couldn't keep up with them. And so, then we have that discussion too. What does that involve in terms of them feeling that they are able to get what they need, lead the lives that they want to live, and have the quality of life that they want as a woman going through menopause? So other things that can happen, a woman can have, sometimes different headaches, body aches. It definitely becomes more challenging to lose weight when you go through menopause, again, just because the hormones have shifted and things are a little bit different. So that's the first thing I want you guys to keep in mind in terms of the three things that I want you to remember if you're starting to feel some menopausal symptoms, things to keep in mind when you go to see your provider, okay? So the second thing I want you to keep in mind is when you go to see your provider, there are going to be some things that we talk with you about just to try to figure out where things are, especially if you're interested in getting some hormone replacement therapy to decrease your menopausal symptoms. And it's important for us to know if you've ever had a mammogram. If so, when was the last one? If you have any other medical conditions going on, high blood pressure, diabetes, and if so, how are those being managed? And those are important, especially the mammogram. That's important because there have been some studies that have shown that women on hormone replacement therapy, depending on the dose of that hormone replacement therapy and depending on how long they're on that hormone replacement therapy, that can sometimes put them at increased risk for certain types of cancers. And so one of the things that is always part of the conversation when I'm seeing a patient who is interested in hormone replacement therapy is, when was that last mammogram? When was that last pap test? Especially these days as pap tests, our guidelines continue to evolve, And whereas years ago, women used to have a pap test about every year, now, and it's a good thing actually, now if a pap test is normal, if a woman has a negative screen for high-risk human papillomavirus, then pap smears are being spaced out more. Some women have pap smears every 3 years, some every 5. And so all of that is important as part of the conversation too. So that's definitely an important thing to keep in mind when you go to see your provider, is keep a calendar of, if you've ever had a mammogram, when was the last one? And then that helps us to be able to facilitate getting a copy of that report if we don't already have it, so we can know where you're starting at baseline. If we do recommend or start you on hormone replacement therapy, it's important for us to know where you are at baseline, so that if anything shifts, if anything changes, we can compare where you are when you start the medicine compared to where you might be later on, and make a recommendation overall that improves your health. So that's the second thing. The third thing is, what about those women who are either already on hormone replacement therapy or who are interested in starting hormone replacement therapy? Okay, so that's important for us to know. If I'm seeing you as a new patient and you were placed on a prescription by, let's say, someone else about a year ago or so, that prescription is running out, maybe you moved or something else happened and you want a refill, it's very important for you to note which medicine you were taking, what's the dose of that medicine, and how that medicine is affecting you. Is it helping your symptoms? Do you feel less hot flashes? Do you feel that nothing has really changed? That information in terms of what you're already taking, in terms of dosages and how you're taking it, that's very, very helpful to us to help streamline and make sure we strategize a plan that's exactly for you. Now, there are all different types of hormone replacement therapy regimens on the market. Most commonly, some women will take pills. Those pills can be taken every day, every week. There are also patches. There are also what we call bioidentical hormones that we can speak with a compound pharmacist about, and they can actually tailor something that's specifically for you. Now, a lot of women, even though compound hormones are not FDA reviewed and approved, a lot of women find some relief from those. And so it's something that is important to mention to your doctor if you think that that's something that you're interested in. And so I know with my patients, sometimes people just need a little bit of something. There may be some patients whose only concern is vaginal dryness. If that's the case, maybe just some vaginal cream, not a tablet that they have to take by mouth every day, and that might get them all the relief that they need. So again, those are just some things to keep in mind. If you happen to be potentially going through any menopausal symptoms, or if not, just again, keep these 3 things in mind as you prepare for your next provider visit. And that is, the first thing is definitely write down any symptoms that you might be having so that you can review them, and also remember to ask your provider any questions that might come up as you are getting ready for your visit. The second thing is to make sure you have a calendar listing of some different preventive health things that you may have been doing. So when was your last mammogram? When was your last pap test? Are there some things that you need? And those will be some things that you discuss with your provider as well. If a colonoscopy is due, that can be something that is included as part of that discussion. Again, just to have an understanding of where you are at baseline as a woman who might be going through, beginning to go through menopause. And then the third thing, of course, is if you're taking any hormone replacement, be sure to know the name of the medicine you're taking, know the doses, know the frequency with which you take them. And if you're interested in starting, that's also a good time to talk with your provider. A lot of times, if I'm starting someone brand new, I'll start on the lowest possible dose, because part of this is seeing what your body can tolerate. If your symptoms are better with just a small dose of hormone, then that's the way to go, because we don't want to put too many hormones into your system. We want you to be, as much as possible, to feel more like yourself with as little additional medicines as possible. One other thing, just for me to mention before we begin to wrap up this Facebook Live session. And please, if you have any questions, please put them in the chat. I'm more than happy to answer any questions you have. But one other thing, I've talked about menopause and the average age being 51. That's if a woman goes through the natural process. Her body goes through the natural process up to age 51. There is such a thing as surgical menopause. Surgical menopause happens for many women before age 51 if for some reason they've had a hysterectomy and their ovaries were removed. That's surgical menopause. That's when the body stops producing these hormones, not because the woman naturally went through the process on her own, but because there was a surgical intervention and her body suddenly was without the some of the organs that are required to make those hormones and to help her feel okay. So that's what I wanted to talk with you guys about today, menopause. Again, I'm happy to answer any questions. If you thanks, Natasha. So we have a question. What's the earliest age you have seen a woman in menopause? Great question, Tasha. So I've actually seen a wide range. I've seen early 40s. Some women might start to feel some symptoms early 40s. There are some women who have what we call premature ovarian failure, and that can happen. Really, it just varies. Sometimes women as late as their late 30s can start to see signs of premature ovarian failure. I've had that happen to a friend where, for no reason that they could determine medically, her period, she saw her last period when she was 38, and, they did a workup and everything seemed to be okay. But when they checked her hormone levels and her blood work, her hormone levels were in the range that showed that she was already in menopause. And so that's probably the youngest I've seen, late 30s. And so yes, it can vary. Sometimes it's also related to what has happened in your family genetics. So if in your family women tend to go through menopause a little bit later, that might be the scenario for someone who is going through the natural process and hasn't had surgery to remove their ovaries. So thank you for that question. Okay, great. All right. I don't see any other questions right now. So I'm going to go ahead and close out for today. I want to thank you all so much for joining me. Next week, I've had some questions about preventive health visits for women. What is included in preventive health visits for women? When should they be screened for certain things? So next week, Sunday at 4 p.m., we're going to talk about preventive health visits for women, what's required or what's recommended at each group, whether you're age group, whether you're 17, 21, 25, 68. What does the American College of OBGYNs recommend for women if we are to try to be good stewards of our health and do some preventive health care? So I look forward to seeing you next week. Please join if you can. And again, my name is Dr. Madeline, your board certified OBGYN, international speaker and published author. I help women at all stages of life receive specialized gynecology care and access birth control that they need on their time. If you'd like to follow me on social media, I'm on Facebook, Instagram, and Twitter as Dr. Madeline MD. That's DrMadeline MD. Thank you so much for joining today, and enjoy the rest of your Sunday. Bye-bye. Thank you, cuz.